Advancements in HIV research have made it possible to prevent an HIV-positive mother from transmitting the virus to her newborn baby. Medical experts say that pregnant women and those planning to have babies should get tested for HIV as early as possible. This will help them, especially those infected, to start medication early.
Preventing a child from getting HIV from the mother starts right from when the mother gets in contact with a midwife. That is in antenatal care. The first visit a mother makes at the antenatal clinic, we take the mother through the routine counseling and testing for HIV. If the mother turns out to be HIV positive, is immediately started on ARVs. The treatment is immediate. We don't wait for any other moment. So the mother keeps on the drugs until delivery. And on the day of delivery, it's the midwife's responsibility to make sure that the child being born does not contract the virus.
The medical experts advise that an HIV-positive mother should also attend all her antenatal visits and plan to give birth at a hospital and not at home or with a traditional birth attendant. This will help reduce the risk of her baby contracting HIV/AIDS. Antenatal visits are key for pregnant women living with HIV/AIDS, and experts say the mother receives tablets to build her blood levels. She gets malaria medication, vaccination to prevent tetanus, medication for deworming, and care from the health specialists to prevent HIV transmission to the baby for HIV-positive mothers. 50% of all mental and physical ability of a baby is formed during pregnancy, and mothers should ensure taking the right precautions for the baby. During the antenatal visits, mothers are advised to talk to the doctor about options for delivering the baby without risking HIV contraction by an HIV-positive mother. Medical workers mention that the risk of mother-to-child transmission of HIV is lowest when an HIV-positive mother chooses to have a cesarean delivery. When the baby is born, it receives HIV medicine right away for 4 to 6 weeks to protect it from any infection from the mother.
You have to set a very clean environment for the mother to deliver. That's taking precautions on infection control. The midwife herself should be enclosed in protective gears, gloves. You must have a good apron. You must have a mask as you conduct a delivery, because the protection is between you and the mother. Then you must set sterile instruments. When we say sterile, they are very clean and boiled. Yeah, that's what we call sterile. They are cleaned and boiled in a hospital setting, prepared for the mother to deliver. Then on delivery, there is what we call episiotomy. Episiotomy is when you find the birth canal narrow and you cut the mother's birth canal. So you must do a timely episiotomy so that you don't let the mother have a tear and cause contamination of the blood. The next, you must have timely cord cutting.
If a baby survives getting infected with HIV while in the womb and during childbirth, it may get HIV during breastfeeding. Here, a mother is expected to continue receiving treatment since breast milk can also have HIV, which she can pass to the baby.
The mother is given the drug. This helps to limit the amount of viruses circulating. So after delivering our child, the mother continues her ARV treatment, and the child is also started on an ARV syrup. And the mother is supposed to breastfeed the child for the next 1 year. The child is not deprived of breast milk. To avoid malnutrition, we advise the mother to continue breastfeeding until the child is 1 year. I think that but the child continues treatment for 1 year, and at 1 year and a half the child is tested. It is believed that the mother's antibodies stay in the child for the next 18 months. So for we to get the right results, it's better we check the child for HIV at 18 months. 18 months is 1 year. Then we can know whether the child is HIV negative or HIV positive. But the percentage of those who do not get the HIV virus is very high. So the precautions matters from antenatal to child delivery.
Worldwide, while mother-to-child transmission rates are low in developed countries, it remains an epidemic in developing countries. Statistics from Uganda's Ministry of Health shows that mother-to-child transmission of HIV/AIDS accounts for 18% of all new infections in Uganda. This hampers efforts to weed out HIV/AIDS infections. According to Uganda's population-based HIV Impact Assessment Report of 2006, Uganda has made a lot of progress in the national HIV response, with the national prevalence of HIV at 6% as compared to 30% in the early 1980s, when many Ugandans were getting to know about the disease. More combined efforts to inform the masses about HIV/AIDS will protect Uganda's next generation and realize the target to have an HIV/AIDS-free Uganda by 2030.